Hello, my name is Sydney Patterson, and this presentation examines implementing telehealth in a healthcare system. This is for Rhodes State College of Nursing's NSG 3030, Nursing Informatics and Tech Healthcare. This presentation will begin with an introduction to telehealth concepts, followed by implementation considerations, advantages and disadvantages, operational and organizational impacts, and conclude with key findings from the literature. Although these terms are often used interchangeably, they have distinct meanings. Telehealth is the broadest concept and includes both clinical and non-clinical services. Telemedicine focuses specifically on provider-delivered clinical services, while telenursing emphasizes nurse-led remote care and patient support. The primary difference between these models is scope and focus. Telehealth includes a wide range of digital healthcare services. Telemedicine centers on diagnosis and treatment, while telenursing supports nursing functions such as triage, education, and follow-up care. In practice, these models support healthcare delivery in different but complementary ways. Telehealth enhances remote monitoring and coordination. Telemedicine supports clinical treatment remotely, and telenursing strengthens patient support and continuity of care. Successful implementation requires more than technology alone. It depends on infrastructure, staff training, workflow integration, regulatory compliance, and ensuring patients have access to and can effectively use these technologies. Telehealth systems offer many advantages, including expanded access to care, greater efficiency, improved patient outcomes, higher satisfaction, and stronger collaboration among providers. These benefits have contributed to growing adoption across healthcare systems. Despite these benefits, challenges remain. Technology barriers, privacy concerns, connectivity issues, and limitations for some clinical assessments can affect effectiveness. Addressing these barriers is important for equitable and sustainable implementation. Current literature supports telehealth as an effective model for improving access and efficiency, while also identifying challenges related to infrastructure, health equity, and workflow integration. Common themes emphasize the need for training and organizational support. At the operational level, implementation focuses on how telehealth technologies are incorporated into daily clinical practice. Success depends on workflow integration, staff readiness, and coordination among healthcare teams. Telehealth supports remote monitoring and coordination. Telemedicine supports virtual diagnosis and treatment, and telenursing focuses on nurse-led triage and patient management. Together, these models improve efficiency and continuity of care. At the organizational level, implementation requires leadership support, policy development, infrastructure investment, and strategic planning. Long-term sustainability depends on integrating these systems into organizational operations. Although each model has unique needs, telehealth often requires system-wide integration. Telemedicine emphasizes clinical protocols, and telenursing supports nursing workforce development. All require collaboration, training, and policy support. In conclusion, telehealth, telemedicine, and telenursing are transforming healthcare delivery. When supported at both operational and organizational levels, these models improve access, efficiency, and patient outcomes while helping create a more sustainable healthcare system. These are the references for the literature that was reviewed throughout this presentation. Thank you.